Start the recording. Screen again. Okay. Let's go up the chat. All right, I'm gonna go ahead and admit. Good afternoon, everybody. Thanks for joining us today. Hope everyone is having a great day.
Hi, ladies. Good morning.
Hello, hello. Where are you joining us from?
County Care Plan, Chicago.
Love it. Yes, welcome. Happy
You
to
guys
have
might
you here.
remember me. I sent quite a few people by. My name is Michelle Robinson.
Yes, I recognize your name. We are so
Okay.
happy to have you here.
All right. Thank you, guys.
Absolutely. Let's get everyone admitted and we will get started here. We've got a lot to cover, so we definitely want to kick off on time. Let's see here. All right. Well, thank you everyone for joining. We are so excited to go through this with you today. We have some great guests here to go through this and really just shed some light on mental health. So we have Carolee from NAMI in Florida, and then we have Carly from Brave Health, who is an internal therapist here. And today we're going to talk about breaking the stigma. So we've got some just overall content, a little bit of information about NAMI, and then a little bit of information about Brave. And then we're just going to do a deep dive conversation about breaking the stigma. And then at the end, we'll have some time for Q&A. If you do have any questions throughout the presentation, feel free to put them in the chat. We'll answer them the best that we can throughout the webinar, and then we will also answer at the end. So you're welcome to save them for the end, but if you want to put them in the chat just to get them off your mind, feel free to do that as well. So without further ado, though, I am going to pass it over to Carolee to talk a little bit about NAMI first.
Thank you so much. And thank you all for making the time to be here. I'm not going to read this slide, I promise. I just want you all to know a little bit about how NAMI got started. It basically was started by two mothers who had adult children who had been diagnosed with schizophrenia, and they just were not pleased with the answers they were getting or the support or the help. So in 1979, they got together with other families and started their own group of mutual aid, mutual support, sharing their experiences, strength, and hope. And from that humble beginning, we now have over 600 organizations. We're in all 50 states and DC. Florida alone, we have 20 affiliates here, plus state organizations. And our mission really is just about improving the quality of life for individuals and families affected by mental illness through education, support, and advocacy. And I think the real difference for NAMI is it's all about lived experience. We know what stigma is like, whether it was something that affected us as a person with a diagnosis, or like in my case, family members who suffered from mental illness. We know what it's like when people can't talk about what's happening and how much that makes things worse. So that's why we're here. And if you go to the next slide, please. Again, I'm not going to read it all, I promise, but I just want you to know that NAMI offers a lot of education programs geared to families, geared to peer-to-peers for people who have their own diagnosis and are working together, home front for veterans. We even do some trainings for primary care providers because we know that they treat a lot of mental illness, whether they want to or not. It presents in those offices, so we want to help them do that. We do community presentations because that is one of the most effective ways to break down stigma, absolutely, is to get out there, share our stories. When we're willing to talk, it's amazing what people will do to respond. They'll open up and they realize it's okay. We do ongoing support groups for families and for peers. And then we also have some outreach and advocacy. And I want to talk a little bit more about workplace wellness and peer specialists on the next slide. Our workplace wellness, this is relatively new for us. The reality is about 1 in 5 adults in America has a mental health issue or condition. And most of them, quite frankly, are in the workplace. They're working, they're in society, but it can affect a business's bottom line. I mean, I was amazed to see the difference in unscheduled absences for people who have mental health issues versus those who say their mental health is good or excellent. That's a lot of lost productivity. And if anybody in here runs a business, you can understand that. So we try to go into businesses. We will offer them opportunities for training. We'll train their managers. We'll even look at their insurance policies and their EAP. Are they effective? Are they working? Because we want to reach out to people where they are. And we want to help businesses know how to promote employee wellness within the parameters of a business relationship. And then peer specialists is also relatively new for us. This is a field where someone can take their lived experience, maybe even something they felt ashamed about, and it turned it into a positive, to an asset, a strength to reach out and to help other people. And that is so empowering. But what we want to do at NAMI is we want to help these people to maintain their personal and professional wellness. So we run monthly support groups, we do trainings. Peer specialists, it is a profession and it needs to be treated like that. And the people working in it need all the support we can give them. It's not a substitute for therapy, like for what Carly does and is going to talk about, but it's a great adjunct. It's a great way to keep that therapeutic trend going in a positive direction. They help provide support and most of all, empathy. I'll tell you, there is nothing like somebody saying, a client or patient saying, well, you don't know what it's like, and someone being able to say, oh, really? I sure do. And that just builds such rapport and it builds hope. And we love seeing people who thought maybe they had nothing to contribute in life becoming peer specialists and seeing how much they have to give. So thank you all so much for allowing me to talk about that, and hopefully we'll have some more opportunities.
Right, great. Hi, everyone. I'm Carly, and I'm here today to talk about all the exciting programs that we have going on over here at Brave Health and ways that we're also working to break the stigma. I've been working with Brave as a therapist for almost 5 years now, and it's been so exciting to see really just everything that we have built, all based off the skill set of our therapist and med management team, as well as the needs of the clients that we provide. So starting off, just a little bit about what we have going on over here at Brave. So we offer medication management, we offer individual therapy. With that, we also have different programs such as PMAD, which is for pregnant mothers. That is a program that lasts all the way from pregnancy through a baby's first year of life. We offer EMDR, we offer DBT, and peer support services, which is something very in line with our presentation on NAMI that Carolee just presented on. So we have that going on at Brave as well. We have different groups. So we offer many groups, some for men only, some women only, some mixed. For adults, for teens, in English and Spanish. And some of the most popular groups that we have going on are different trauma groups, SMI challenges, ADHD, chronic pain, Girl Talk, which that's a pretty popular adolescent group that we run. I think we even have a few of those going on right now. We have a suicide group, which is part of our Zero Suicide program, and I'll get to that in a little bit. Substance abuse groups and LGBTQ groups. All of our groups are capped at about 10 to 14 clients, depending on the group. And then when a second group is needed, then we implement that just based on need. All right, next slide, please. Okay. So Brave is a total telehealth platform for really all things mental health. We reach clients from the comfort of their own home. And because of that, we are able to reach a really wide population. We see clients in really rural areas that wouldn't have access to mental health programs if it wasn't for telehealth, like ourselves, those who don't have transportation, a million different reasons. And Brave also accepts most insurance companies, and we're also very proud to work with Medicare and Medicaid. In fact, a lot of the therapists and nurse practitioners that we have join us are coming here for that reason. They do want to work with the underserved and really love everything that we have going on for our clients and the services we provide. Brave admits most patients, really unless there was a need for a higher level of care at that moment. So sometimes what that'll look like is if somebody has a medical need or maybe a detox or something like that is needed, we'll tell them, oh, go complete that first, and then you're welcome to come join Brave. So we are able to accept most patients, which we're really excited about. Another really neat thing about Brave is some clients participate in one service while others, in fact, a lot participate in multiple services. So because we are telehealth, we are considered a bit of a lower level of care. But if somebody has, possibly 3 or 4 appointments in 1 week with us, if they, let's say, have medication management, their therapy appointment, group, or maybe even 2 groups, or, peer support, that could be up to, 4 appointments. So in a sense, like we're a low level of care. We're not, considered an IOP or anything like that. But when you start seeing, the same client 3 or 4 times in a week, that's really great wraparound care. So really just all based on need and what services the clients want to participate in with us. All right, next slide. Another really cool program that we have going on over here at Brave is our Zero Suicide program. Brave established this program in 2022 and has been working very closely with the Zero Suicide Institute ever since. As far as we are aware, and what the Zero Suicide Institute has told us, is that Brave is the first telehealth behavioral health company to implement the Zero Suicide framework. And really, again, the purpose of Zero Suicide is just breaking that stigma, changing our conversation and how we talk about suicide. We're inviting clients to have very open and honest conversations about suicidality, and knowing that they will only be hospitalized at a last resort. If they're not able to contract for safety, I'd say very, very rarely. Our Zero Suicide pathway consists of a few different kind of like extra layers of safety, which I'll get to right now. So we complete increased CSSR screenings. Basically, we'll be completing the CSSR every single appointment until a client is at baseline, safe functioning, to not complete those every single visit. We have a Zero Suicide safety plan that we use and actually implemented from the Zero Suicide Institute. There's also an app that they recommended, so we're using that as well. It's free to download on all smartphones. And what's really neat about the app is it has additional resources on it. And we've even had family members, I think this is pretty cool. We've had family members also download the app on their phone and fill it out with the client. So it is, a really great support, again, breaking that stigma and getting, families more involved in care. So every Zero Suicide client has a safety plan. We have treatment plan objectives. So we are checking in just on suicidality and safety as part of just, standard treatment. One of my favorite parts of the program is the outreach. So if, let's say, a client is maybe having a harder week, or is just in need of a little extra support, we actually have a Zero Suicide outreach team, and they can either send a text message or a phone call throughout the week to clients who need it. And that's something that our clients really do enjoy for when they need it. That's also helpful if, the therapist is busy, but maybe they want to check on that client later in the week, but don't necessarily have the time because they have a full caseload themselves. We can say, okay, well, we're going to have somebody from our Zero Suicide program reach out to you later in the week. Is that okay? And as long as they are, we do that. We check in with them, see how they're doing, remind them of their next appointment, see if they need to set up any appointments, really just everything like that. Sometimes we send just a text message because maybe that's all they want. And it's always individualized, just checking in. Some of our clients don't even respond to the message, but it makes them feel good just knowing that somebody, took the time to reach out and was thinking about them during the week. So that's something pretty neat. We also offer Zero Suicide groups. These are very, solution focused, safety focused. The goal of the Zero Suicide Group is once you are, maintained at baseline functioning, to graduate you and put you in one of our other groups for a longer amount of time, kind of thing. But that's another really great support through our Zero Suicide program. And that's really everything that we have going on over here at Brave. I'm sure we have a lot more going on too, but that's just what I had planned to talk about today with breaking the stigma.
Thank you so much. Excuse me. Thank you so much, Carly and Carolee. That was amazing. Appreciate that insight on both. I'm going to turn it over to Ashley Womble, who is with Brave Health, and she is going to go through some questions with Carly and Carolee about our Breaking the Stigma topic.
Thank you, Jenna, and thank you so much. Great presentations. I know a lot about Brave after being here for 3 years, but even I learned some things here. So it's always great to hear this. So we are here today to talk about breaking the stigma. I'd love to hear from Carolee or Carly. What do you do when someone makes a stigmatizing comment about mental health, right? What are some practical tips to engage with that person who is saying, something that's stigmatizing, and clearly this is a person that you're trying to convince that maybe, care could be a good idea for them?
Mm-hmm. Yeah, a lot depends on the context. Is it being kind of malicious, or is it just ignorance, for want of a better term? So sometimes I think the best way is to always be polite, but to, basically kind of don't just let it pass. I think I would say just to say, I noticed you used this word, and have you thought about how that would make somebody feel if they had depression or they had that condition? That try to build that sense of empathy and encourage people with some alternative language that they can use. We have a tendency in our culture, and I'm guilty of it myself. Sometimes I'll say, wow, it's been a crazy day, or it's been an insane day. And I don't mean it in a bad way, but I even catch myself. And I have to say, no, think of some other language. It's been a chaotic day or unpredictable. So trying to help people think of other words. And again, just emphasizing how that might feel to someone who's hearing that language.
Thank you.
Yes, for sure. Just open communication, educating, finding different words to use. And let's say it was a client, that made a stigmatized comment or something like that, really processing it with them, normalizing, empowering, coming from a solution focused kind of attitude, or even challenging and replacing. So, well, what if somebody else said that? Like, what feedback would you, give to them? Or what would you say to a friend who just said that about themselves right now? Because usually the answer is very different. And, our clients tend to be really hard on themselves, I think, sometimes. And then that really gets in their way, when they start kind of like believing in the stigma as well. So really identifying and challenging those.
Yeah, and I think one of the things we've worked on in NAMI is what we call person-first language, or person-centered, rather than, especially even in the clinical world, sometimes there's a tendency to identify people by their diagnosis, or to say client. And sometimes it helps to encourage professionals to use somebody's name and to avoid it. A diagnosis can be helpful, but you don't want it to be a label that defines the person.
For sure, definitely focusing on the symptoms. I mean, right, diagnosis is helpful. It can normalize, it can give a name to something. It could be really helpful with medication management, kind of things like that. But let's focus on the symptoms at the end of the day and treating those, and less on a word per se. And really educating, so I know we're not there yet, but working on getting like mental health to a place where it's as accepted as like a medical diagnosis, because no one questions medical diagnoses. We take those very seriously, following, treatment protocol, working towards remission, all those great things. But really we can implement those same things into mental health. So I like, using that comparison when educating, family, friends, community support, and also the clients themselves.
That's great. That's really great to keep in mind. I'm really curious how, we are all working in mental health day to day in various roles. I think we can sometimes assume that people understand and know what we know. So I think it can be good to just bring back what are the common misconceptions that are out there in 2025 that, that people really think, right? That we still need to work around. You may have an answer, you may not. You may that's okay.
Well, I know for us at NAMI, I mentioned the workplace wellness and why that's important is because sometimes people assume if you have a mental health diagnosis, they equate it with homelessness or incarceration or disability. And sometimes that is true. But again, the majority of people with a mental health condition are out there in society. They are working, they are functioning to the very best of their ability that they can. So I think recognizing that this is not an uncommon situation at all. And to Carly's point, yeah, accepting it just like we do physical diagnoses and not looking at it as something weird or something that's a real outlier of the human condition because it's not. And then I think the other thing for us too is just getting the word out about effective treatment. I started in this field. I'm not even going to say it because I don't even want to think about how old I am, but um, we have come such a long way in the medications that are available. Carly, you mentioned like the DBT and those kind of therapy modalities that we didn't have, 20 years ago or didn't have in widespread use. The field's come a long way, and people need to know that there's a lot of good reasons for hope. There's a lot of effective help out there.
Thank you for that.
Sure. I think another misconception is that like mental health treatment is for the weak. When it really takes a tremendous amount of strength to, show up for yourself, identify the barriers and, some of the things that, the average person out there, just kind of buries, their entire life, but actually being able to say these things out loud, and work through them, like that takes tremendous, hope and strength. And I think for the most part, or just being in this field for over a decade now, I think the stereotype of mental health, I think in real life, like when actually working with these individuals, it's the opposite of that. Like these are some of the nicest, kindest, and most caring individuals. So I really think that's another, pretty big misconception.
Thank you, Carly. Carly, I have a question for you about how NAMI supports individuals with lived experience in becoming leaders in the fight against stigma. I know lived experience is a movement that's been going on for a couple of decades, but really I feel like NAMI is putting people front and center as on the front lines of fighting stigma who have that experience. Can you just share with us how you're able to do that as an organization and what you've seen the impact can be on the individual?
Sure. One of the things that I love about NAMI is that we invest a lot of time and money into educating people. And by that, I mean like we have manualized kind of training for people to do presentations. We don't just send somebody out in the community and say, hey, tell your story. We work with them, we coach them, we teach people how to tell their story in a way that connects with people and is effective, but doesn't cause them to feel badly. Because that's important. We don't want people to tell their story and feel badly about anything that they're sharing. So we go all the way from presentations for youth, middle and high school youth. We train people how to talk to those audiences. We have a program called NAMI Smarts for Advocacy, where we actually teach people how to talk to their legislators and policymakers, and not just what to say, but how to get an appointment, how to approach them, how to connect and get them to listen to you. And we work with them to come up with speeches all the way from a 30-second elevator pitch to being able to testify in front of a legislative committee and get your point across and to feel confident in that. And we continue to do refresher trainings. We offer support because it's really important when you're asking peers to support each other that you give them the tools and the skills that they need to feel confident with doing that. So that is probably the biggest thing that the state organizations do. Our responsibility is to train group leaders and facilitators and advocates. And through that process, they go on and they help others and train others, and it really just grows. So it's something that we prioritize, is just helping people to be effective advocates for themselves and the people they care about.
That's wonderful. Thank you so much for sharing that. How can people get involved with their local NAMI?
I beg your pardon, I didn't quite hear
How,
that.
if someone in the audience wants to get involved with NAMI, how would they do that, or how could they tell one of the members that they work with or clients?
Well, we have a website. It's NAMI.org, NAMI.org. You can go on there and you can get links. Thank you. Somebody put in the chat. Appreciate that. And that's a good starting point. You can learn about the programs we have. They have links to all the state organizations and local affiliates. And we get a lot of calls at NAMI Florida. We operate what's called a warm line. It's not a crisis line. It's not 988, but people can call and ask for information. We always try to connect them with a local affiliate and local resources. So people can call, people can text, people can go to the website. And I did want to say too that all of our programs, everything that we offer is free. We do not charge participants anything. So we really focus on having easy access, and we are doing a lot of things virtually as well as in person. So we have options for people to work in whatever way is most comfortable for them. Like Carly mentioned, some people have transportation issues or they live in a rural area and that kind of thing. So that virtual option can be helpful as well. But it's very easy to get involved. Membership is as cheap as $5 a year, and I think it's a great investment.
Thank you. I love that you mentioned telehealth and that that's a way to reduce barriers. And that's certainly, very much what we're here trying to do. Carly, I was wondering if you could talk a little bit about, just through your practice, how have you seen telehealth be effective in reducing stigma?
Oh, absolutely. I think just the accessibility, it's way more discreet if that was a concern for someone. Most of our clients do their appointments even from their phone. So God forbid, they're in their room, but somebody walks in the door, it could literally look like they're just FaceTiming, anyone type thing. Or same, we have a lot of clients do their appointment on their lunch break. So, they'll go to their car. Again, it looks like they're just talking to anyone. I think convenience is also huge. So like there's not as many excuses in that, like I can't get there or there isn't time, Brave and so many other, even telehealth platforms offer, night, weekend appointments, lunch break, morning, there's a lot of flexibility in that. I think that there's something to be said just about being in like your home or your safe space. We tell clients get, in a confidential setting, but what's most comfortable for you for your appointment, kind of thing. You don't have to worry, about seeing your provider, like, shopping at the store. There's a good chance they don't even live anywhere near you. They are going to be in your same state, but they could be anywhere in that state. As well as like if you drove to an office, you won't have to worry about seeing your neighbor or like, an acquaintance or really anything like that. So there is a lot of privacy. Something else that we do over here at Brave is at the time of everyone's assessment, one of the first things they do is create a safety phrase. And then that is carried over onto like every appointment we have with them. It's right there. So if they said something significant to them that they'll remember, like I got to go check the mail or going to walk my dog or going to go get coffee now, that's a way of ending the call without making it obvious, basically saying that privacy's been compromised.
Wow, that's incredible. See, learning more about Brave, even here after 3 years, just because this functionality does allow this to be more private, right? And so we can be in the lives of people that maybe normally couldn't even go and access therapy in any way. So that's really incredible. I know we probably have some questions from the audience for Carly and Carolee. So I want to open it up there. I can read the questions if people want to drop them in the chat. And if you have questions just about Brave as well, please feel free to ask those. Okay, great question that just came in. Do you guys have any therapy or support groups for Williams syndrome? And for those of you who don't know, Williams syndrome is WS or WBS, Williams-Burnham, I'm not sure if I'm pronouncing that correctly, syndrome is a genetic disorder that affects many parts of the body. So I can say that I know that we definitely do not have a specific therapy group for individuals with this specific syndrome. What we do have are a number of groups for people with chronic illnesses that can help them learn to cope. Carly, do you want to talk a little bit more about our chronic illness and some of the grief groups that are not in that group, but kind of related? They're not.
Yeah. Yeah, absolutely. So we do have some different chronic pain, chronic illness groups, as well as therapists who are specialized in working with pain or illness. So we definitely would match appropriately. So no, we don't have specific to like a particular diagnosis, but they would be matched with other clients who also experience some similar symptoms and struggles.
Okay, guys, so can I come off? I want to come off the the mic. I want to come off
Absolutely.
the speaker for this. Okay. So, yeah, this is a 20-year-old. This is a member that I have. He does everything on his own, but he is 20 years old. And I'm looking for age appropriate. His dad, which is his responsible party who helps him out a lot, right? He's really independent, but because of some intellectual issues, right? Because that's a part of the syndrome. I'm looking for a space or a referral where he can feel comfortable. I understand that it might not be specific to this, but it'll match. So am I able to refer him to you guys? Or, let him and his dad, as a duo, because that's his best buddy on the planet. Something that they can explore together with you guys, basically is what I'm saying. Can I put in a referral for him?
I would definitely put in a referral. And as soon as we are able to do the assessment, that's when all of those questions they'd explore all of those options. And you can put in a note, and we have it here. You'll put in the referral to this team anyway. So we know about this and we'll be sharing those notes. But you can
Absolutely. I will put in the note. But I would really appreciate if you guys can talk to his dad first. This is his dad's suggestion, in which his son agreed. So I would be just pleased if you guys can explain to him exactly what it is that you can offer, right? Before he even takes this to his son. So I will put in the referral, but I put it in his dad's phone number and everything, okay?
Yeah, that makes sense.
All right, thank you
so much. Thanks for coming off, Mike, onto camera to do that. Thanks.
Like another question came through, specifically about, is there a group for teens who have chronic illness / pain? Carly, you want to take that one?
I would have to look into that and find out for sure. I know we have had that in the past just based on need. But even when we don't have a current group, we're always taking referrals. And then as soon as we can start a group, we absolutely will. But I would have to look into that to check for sure.
Thank you. What other questions? And feel free to throw them in the chat or take yourself off mute.
I have a question. When placing a referral, in the option where it says if they've recently been discharged or admitted for anything, it asks the date of discharge and then it asks for any additional comments. There's not a place to put those comments. The box only populates for a date and doesn't allow any additional details to be placed. So is there a place that I should be putting those that I'm missing?
Yep. I think if you go, I'd have to get on here, but if you go to the next screen, I believe it is, there's going to be that box where you add the additional notes. I think it might be on the next screen.
It is on the next screen, but I didn't know if that's where those go because the question asks for the date and any additional comments, but there's not a box directly there, but there is one on the next page. So I'll place them there.
Sorry about that. Thank you
That's
for that.
okay.
Sorry for the
That's good
confusion.
feedback for us.
Yes.
We are going to be in making the forms easier to use, and that's great feedback. Thank you. We need to have that next to the date.
May I ask a question, please?
You sure can.
Thank you. Can someone that does not have county care refer themselves to Brave Health?
Yeah, absolutely. So you're saying like, can a patient just go directly on our website and refer themselves?
Yes.
Yes, absolutely. I will drop that link in our chat here for you.
Thank you.
You're welcome. Any other questions? Sorry, Ashley, go ahead.
I was gonna say the same thing. Any other questions? We're here to answer them.
Yes. Well, no other questions. Ashley, is there maybe another question we have for
Yeah.
Kaylee and Kelly we could close this out with?
Yes, let's close it out with I think that I'd love to hear, since you've both mentioned you've been working in the field for a while, and you've seen the way that people talk about mental health and accept it for themselves change. Where do you think that we can be in a few years? What could the future look like?
I love that question. I've had the privilege of doing some presentations to middle and high school kids, young people. And what amazes me is how open they are to talking about mental health. I live in Marion County in Florida, and the schools allow kids to choose a project and choose a charity that they want to donate to. And for the last 3 years, they have chosen NAMI in Marion County. And one of the teachers said, when I started teaching, it was all about the animal shelter or it was the homeless. But these kids are so aware of mental health issues and they're so open to talk about it. So I see the future being pretty optimistic. I think we're going to get to where, as Carly said, it's accepted as any other health condition that can certainly be treated, certainly be managed, and is nothing at all to feel badly about or to see as a sign of weakness or bad parenting or whatever. These are conditions that are health issues, and there's a lot of hope. So I'm excited for the future.
Absolutely. Even in the, the children's shows and everything, it's incredible learning like deep breathing technique and, just things that we didn't used to see. I think there is just an increase in openness, acceptance, advocacy, awareness. I think technology has helped. I think even the pandemic even helped in a sense a few years ago, and just kind of people recognizing they're not okay. And I think that that's also really opened the door for telehealth to also be, accepted, an accepted form of treatment. But yes, I see really great things as well.
That's the good news that we all need, right? Is that the future is going to be brighter than yesterday. I think that with people like you working in the field, both on the systems level and individually, we can expect. So thank you so much for your time today.
Yes, thank you both. Great presentation. Last call for questions. And then I will also be following up with an email to everyone with these slides, the presentation from today, a little information about NAMI, some information about Brave, and then a certificate of completion as well if you attended today. So be on the lookout for all of that. If anyone does have any questions for us after that come to mind, please feel free to reach out to us. I'll pop our email in our chat again here so you have it. We're happy to answer any questions that you have. Thanks, everyone.
Thank
Have a
you
great
all
rest
so
of your
much.
week.
Thank you.
Bye-bye.